Hi everyone, welcome back. So today I'm going to be doing a bit more of a sports therapy related post, and I'm going to be talking about shoulder impingement, which if you've had it, it is pretty painful at times, and can result in compressed nerves and things, so can really affect your ability to do certain activities. It is actually a really common cause of shoulder pain, and usually it would improve after a few weeks, sort of with some treatment as well. But if left untreated, it can become a chronic problem and really affect your ability to do your job, or as I say, basic sort of daily activities. So what is shoulder impingement? So shoulder impingement is basically, it occurs when a tendon inside the shoulder joint rubs on the bone as you lift your arm. And so soft tissues can get pinched between the bones of the shoulder. So if you look on this diagram here, so we've got the top of the arm bone here. Okay, and then we've got the acromion along the back, which is that top bone of the shoulder across the back, and tendon here going into the muscle, and ligament, lots of ligaments that come across this area attaching the bones of the shoulder. And then we've got the bursa, which is like the fluid-filled cushion, fluid-filled sac that cushions the shoulder joint. So what happens is, maybe due to injury or repetitive movements in the gym, or excessive pressure through the shoulder joint, you will get inflammation. Quite often it can be inflammation of the bursa here. And so what happens then is that inflammation actually reduces the subacromial space, which is the space between that acromion bone and where you've got like muscle attachments down here. And so when that subacromial space gets tighter, you've got more chance when you move of getting your soft tissues, such as your tendons here, getting caught in that tight space. And so that is your shoulder impingement. So there are two types of shoulder impingement: primary and secondary. So primary is really caused by underlying structural issues and conditions. So it could be something like just for whatever reason having a naturally small subacromial space, or it could be something like arthritis, which of course is an inflammatory condition. Secondary shoulder impingement is usually caused by movement and posture related problems. So any overuse, so if you're sort of overdoing it in the gym, certainly mine was caused through my work and applying constant pressure through the the impacts on the shoulder when carrying out my sports massages. Or it could be something like a rotator cuff tear, so if there's another sort of injury around the shoulder that impacts on that space. So shoulder impingement, I'm going to show you now sort of basically when it occurs, when you feel that weakness. So shoulder impingement occurs really during abduction of the arm. So when the arm is basically lifted sort of out to the side and up. And it's basically when the supraspinatus muscle, which is this muscle here with the tendon here, when that muscle which runs basically across the top of the shoulder blade, or the biceps tendons, or the bursa, these fluid sacs, when they get pinched in this tight subacromial space, that's when the impingement happens. So just below this top bone of the shoulder here. And what happens is that it becomes difficult to reach overhead because this outward movement of the arm is so painful. And because this space, subacromial space, becomes smaller, it makes sort of that movement difficult. So, as you can see, upon moving that arm up, if this space is tight, that tendon in particular of the supraspinatus muscle is going to get pinched in that tight space. Now, I appreciate this is not the best diagram, but so there are 3 stages of shoulder impingement. So pain from the shoulder area resulting from impingement of the structures between the humeral head, so the top of the arm bone, the acromion, which is that bone of the top of the back of the shoulder, and the coracomial arch. So that will basically, that's what results from the impingement. And as I say, there's 3 stages. So in stage 1 here, that basically involves some swelling and possible hemorrhage of the subacromial structures. So whether that's the tendons or ligaments, or possibly even muscle tissue itself. In stage 2, you get tendon fibrosis and thickening of the bursa, which is that fluid sac. And then stage 3 usually involves things like rotator cuff tears, biceps tendon ruptures, because the biceps tendon runs through this space up at the top, and bone spurs. So it gradually, obviously, there's sort of gradual worsening if this isn't treated. So obviously we've mentioned overuse and repetitive movements and sort of their influence on causing shoulder impingement. So I'm just going to sort of go through the main causes a little bit more. So it could be due to injury. So we've mentioned something like a rotator cuff tear, or even a torn labrum, which of course the inflammation from that, tightening of the muscles will then pull on certain areas of the shoulder, causing further inflammation and then, reduction of that subacromial space. Any inflammation or thickening of tendons, or any tears in the tendons, particularly the biceps tendon and the supraspinatus tendon across the top of the shoulder. And this can happen due to injury or overuse or just general wear and tear. They can definitely bring about, as I say again, reduction of that subacromial space. Likewise, inflammation of the bursa, which are those fluid-filled sacs that cushion the joint that we saw in that diagram. If that's inflamed, it's going to take up more of that subacromial space. So, there's going to be less room for those, muscles and tendons to move, as they should, and they may get pinched. Sometimes, people just naturally have a curved acromion bone. There's actually three shapes naturally of that bone. Some people have quite a sort of a straight acromion. Some people have more curved or even hooked acromion bone. So if it's curved, again, that can just slightly reduce the amount of space, just underneath it. Or sometimes people just develop like bone spurs or just growths on the bone, on the acromion, which then is obviously going to make that space a little bit tighter. In terms of risk factors, so who is going to be more prone to developing shoulder impingement? Basically anyone who has repetitive movements, as we've said, overuse is the main factor in causing that inflammation that reduces that subacromial space. So this could be athletes such as swimmers, where you constantly got that repetitive movement of the shoulder. Baseball with that swinging movement. Sports such as this are going to always involve repetitive use of the arms. And then this overuse, as I say, can cause inflammation, which results in those tissues getting pinched because the space is tighter. Frequent occupational overhead lifting, so people like construction workers, and again, it's just that repetitive use of the shoulder. As I say, for me, it was definitely my job, providing very, very firm sports massages on rugby players and bodybuilders, takes its toll because it's just repeated impact, going through that shoulder. Anyone with a natural, sort of naturally narrow subacromial space. So that could either be due to sort of inherited bone shape. And as we've said, some people have a naturally curved or hooked acromion, which typically means that there'll be a smaller subacromial space, meaning that the tissues are more likely to get pinched. But also there could be a narrow subacromial space due to something like, as we said, osteoarthritis, so where you can get arthritic changes to the bones. Another risk factor is just like naturally people will have slightly different shaped acromions. A naturally prominent coracoid, which is it's a projection from the shoulder blade, that will increase the risk of subcoracoid impingement, which is actually less common, so I'm not going to talk too much about that now. Any form of shoulder instability, so muscles, tendons, ligaments, if they no longer secure the shoulder joint, this will cause pain, increase the risk of dislocation and impingement. Previous shoulder injuries, so torn labrum or rotator cuff. Bone spurs, which we've mentioned, that reduce the subacromial space. Coracoacromial ligament calcification, less common, but so this ligament runs diagonally over the rotator cuff in the subacromial space. And then just, some of the usual risk factors, poor posture. If you sort of constantly have your shoulders hunched, this can reduce the subacromial space. So that may be due to poor posture, but also, people who suffer long-term depression tend to have a more hunched posture. So even, that could sort of have an impact. And of course, with most of these things, age. Shoulder impingement is most common in adults over 50 years old. So quite a few risk factors there. Now the symptoms. Symptoms may be sudden or they may sort of come about gradually. But usually the first sign is a weakness or a pain in the top outer side of your shoulder, so sort of around here. And the pain, can be worse at night, especially if you lay on your side. Lying on the affective side, is likely to cause pain and discomfort and therefore affect your sleep. Pain is also worse on lifting the arm, so abduction and external rotation. So abduction is lifting the arm up, and external rotation is sort of any backward movement. So, as we've just said, pain particularly fell on abduction of the arm, so coming outwards and upwards. And also that's sort of when you kind of feel the weakness as well, like your shoulder's going to give way. But a classic characteristic of the pain with shoulder impingement is that initially, sort of and up to when the arm is at about 60 degrees, there'll be no pain felt in this area. But once the arm reaches about 60 degrees and then continues round to 120 degrees, it's in this segment here that you'll be feeling the pain around that top outer part of the shoulder, because that's when the tightness in this subacromial space is going to be really restricted. So yeah, this period you're going to feel the subacromial pain and feelings like your shoulder's going to give way. But then once again, as soon as you go past that 120 degrees, you won't tend to feel any pain at this stage. So so pain is the main symptom. It can, when you do those overhead movements, there can be like a pinching pain at the top of the shoulder. And this will also be apparent, if you're doing any kind of throwing movement, reaching behind where there's some external rotation, or even sleeping on your front with your arms, above your head. And the pain may radiate from the shoulder down to the upper outer arm, particularly during or after lifting or any kind of overhead movement. And as I say, the pain, generally is intermittent, but can develop to be more constant. So besides pain, obviously we have swelling and tenderness, because it's usually inflammation of one of the tissues that is causing the narrowing of the subacromial space that causes the impingement. But reduced range of movement, due to the pain and due to the inflammation, and a general feeling of arm and shoulder weakness, and that can be even if you're not actually using the arm at the time. So certainly for me, when I had it, I really noticed it when I was using dumbbells and I was doing like the lateral arm raises. That's when I really felt that my arm was going to give way, and in fact that exercise became actually impossible for a little while. So treatment, how do we treat shoulder impingement? Well, the aim of treatment really is to reduce inflammation and reduce the pain, and therefore improve your range of movement, improve your muscle strength and your posture, in order to increase that subacromial space and basically restore the function of the joint. I would say non-surgical treatment should really be used for 3 to 4 months. But if after that point symptoms still persist, then potentially surgery may be an option. But of course, it is always the last option. So what should you do if you have shoulder impingement? So as always with any kinds of sports injuries, rest is really important. It's like probably the most essential thing. Avoid those overhead activities, or any kind of rapid and repetitive shoulder movements, but do try to continue with normal daily activities. Ice packs, 20 minutes at regular intervals, will certainly help to reduce any inflammation. So if the bursa or the one of the tendons is inflamed, ice will just help bring that down and hopefully then increase the space, that subacromial space. Physiotherapy certainly can help to improve the range of motion and also to strengthen any weak muscles around that area of the shoulder. So that would most likely be working on those rotator cuff muscles. And exercises to strengthen the muscles and also to prevent further injury. And I will be going through some exercises at the end of this video. Anti-inflammatories such as ibuprofen to help not only deal with the inflammation but also with the pain. But do be careful if you are asthmatic, or if you have any kind of gastric issues, because ibuprofen quite likely will not be suitable for you. So, but you can consult with your GP. Cortisone injections can also help reduce the inflammation and swelling that may be contributing to the impingement. There's also some people actually use platelet-rich plasma or stem cell injections. They may be suggested if there is a soft tissue injury. So, for example, things like a rotator cuff tear, they may then be considered as a treatment option. And as I say, it's, in worst cases, the surgical route may be required if nothing else has helped, sort of after about 4 months. Subacromial decompression may be an option, and what that does is it basically just increases that subacromial space, to stop the soft tissues being pinched. And also it stops, quite often nerve compression. You've got a lot of nerves in that area as well, and nerve compression with shoulder impingement is quite common. So it can also, take the compression off the nerve. So, as I said, I'm going to talk about some stretches and exercises that you can do to, ease the symptoms of shoulder impingement. These following stretches will basically help to improve the range of motion and your posture, but they should only be done if there's no pain. Okay, so if you're getting pain doing them, then you really need to stop. Okay, so the first one of these exercises is a chest stretch. So what you need to do is you place your forearm against a wall. She's doing here. And gently lean forwards, but turn away that forearm. So that you stretch these chest muscles here and around the front of the shoulder. And just hold that stretch. The second exercise or stretch is the supraspinatus stretch. So that will stretch basically across the top, across the supraspinatus muscle. So you place your hand on the lower back. This is certainly the hand of the arm where you've got the impingement. And you use your other hand to basically pull that elbow forwards, keeping the hand on the lower back. And this, as I say, will stretch across that supraspinatus muscle at the top, back of the shoulder. So then we have the anterior shoulder stretch. So you need to grasp the door frame above your head and then move forwards, leaving the arm behind your head to stretch out all down the front of the shoulder there and into the chest muscles. And then we have our posterior shoulder stretch to stretch around the back of the shoulder here. And so you place one arm across the chest and pull it in tight with that second arm, and you'll feel the stretch just around the back here. Now these next exercises are strengthening exercises which will help to strengthen the rotator cuff muscles, which basically stabilise the shoulder joint. But you should only do these if you are pain-free. And I actually recommend these a lot to my clients. So the first one is a lying external rotation. So you want to lay on your side with the affected arm down here, resting on your side and bent at the elbow. You want to start with the hand basically down at the floor, but bent at the elbow. And then you were going to rotate the shoulder so that the hand, which is down here, moves up towards the stomach, so that the hand is pointing towards the ceiling as far as possible. Okay, so you're basically keeping the elbow and the top of the arm against the floor, and you're hinging at the elbow. So this will basically come down. You'll bring it up to point to the ceiling and then arc back down to the floor. And now if you haven't got dumbbells, you don't need much weight on this. You want to start with a light weight of around 2 kilos. If you haven't got dumbbells, you can use a bag of sugar. It will work just as well and do what we need it to do. Okay, and so then you've got your lying internal rotation. So again, laying on your side with the arm to be worked on, which will be this one. So start with the forearm basically parallel. She'll be holding like the dumbbell will be sort of parallel to the floor. And again, we're going to keep the upper arm into the body, and we're going to rotate the shoulder so that the forearm moves forward towards the stomach. And just like with the external rotation that we just did, we're going to hinge at the elbow and it's going to arc down in towards the body and then back. So you're rotating the shoulder internally. Okay, and again, a light weight of about 2 kilos. If you've not got dumbbells, you can use a bag of sugar. It works just as well. Now, once you're comfortable with these exercises, you can then progress to movements in abduction. So we can do some external rotation in abduction. So you can use a resistance band or a dumbbell for this. And standing with the arm, so the arm has been abducted out to the side, okay, to 90 degrees here, so that the arm is parallel to the floor and bending the elbow at 90 degrees. So using this elbow as a fixed point, we're then going to rotate the shoulder so that the hand basically points to the ceiling. Okay, and then again, you're just going to move that forward. So the hand will arc forwards and you'll get the resistance from the band. Okay. Now, there are also a couple of other exercises that you can do to basically strengthen all around the shoulder girdle. These are also really good exercises to do if, say, you have a desk job and you're sitting down all day, constantly using the computer. And so again, using the mouse, you're going to have those repetitive movements. So these will be really good exercises just as a sort of a preventive measure. So the first one is basic retraction. So we're going to basically pull the shoulders back while keeping the arms straight and the head still. So only the shoulder should move, and you're just going to retract the shoulder blade. So then we have the scapular retraction and depression, which is basically, so in this one you raise your shoulders, roll them back, down, and then hold, squeezing the shoulder blades together at the back, and then release. And then just bring it round and really squeezing the shoulder blades together at the back. Okay, and then the final exercise is a scapular push and pull. So with arms stretched out in front of you, we're going to reach forward by moving the shoulders only. So we're not going to move the head, we're not hinge at the joints, we're not going to do that, we're not going to move the neck or the back. Just the shoulders are going to move. So without moving the back or the neck, arms stretched out in front, we're going to move the shoulders, we're going to basically push them forward, and then we're going to pull them back as far as you can, and hold and push, pull, push, pull. And then once you've sort of done that, and you're quite comfortable doing that, you can actually then hold the pulled position and rest your hands against the wall, and then push your shoulders forward against the wall, so that this time you've got the resistance of the wall to work against, but again, not moving the neck or the back, only moving at the shoulder. So there's quite a few sort of basic exercises there, but they can be really effective, when you're sort of starting to strengthen that shoulder following some impingement. As always, if you feel pain on doing any of these, then stop. Feel free to comment down below, ask me any questions. You can contact me through Facebook or Instagram, get yourself booked in for a sports massage as well, because that will really help with the impingement, but only when you don't want to do that when the inflammation is at its peak. So you want to wait for, do your rest and your ice to allow that inflammation to subside, and then book yourself in for a sports massage and do these exercises, and hopefully that should work. Send me any questions you may have, comment down below, subscribe, and then you'll be notified of future videos. I will be doing more on other shoulder injuries, dislocations, slap tears, and looking at other muscle groups as well. So keep your eyes peeled for those. But for now, that is it from me. So good luck with the exercises, and I will see you next time. Okay, bye.